Hey, this is the Proactive Podcast, Session 2. My name is Dr. Jurgis. I'm here with Dr. Kevin and Dr. Alex. We're talking about, sports, medicine, human biomechanics, kinesiology, overall health, all that jazz. Okay? So, today we're talking about a little something called cross-postural syndrome. Dr. Alex, what is that?
So, cross-postural syndrome, the guy that coined that term, his name is Vladimir Yonda. He was a neurologist and physiotherapist in the Czech Republic in the 70s and 80s, and he essentially noticed that everybody has this same pattern of crossing tightness and weakness of muscles, both in the upper body and the lower body.
Yeah, and he actually was crippled by polio for a couple of years.
Yeah, when he was young. He was a quadriplegic at one point for a couple years, and then later through his life he kind of recovered and was able to walk with a walker. But yeah, that's just a crazy fact. I didn't think that was even possible.
What a crazy guy, man.
Yeah.
And you got to think that going through that experience would help him figure that paradigm of, hey, there's a pattern here in terms of tight and weak muscles. And this is a common thing that we're going to see across the board, which is really cool.
Yeah, very common. Pretty much I would go on a limb and say everyone in society has a bit of this.
Yeah, we'll definitely get into that. It's pretty much across the board. Everybody has a similar pattern. There's variations within it, but yeah, it's definitely common. So what does the X pattern mean, Kevin?
We'll start with, it's kind of like different parts of the body. So if you split your body in half from the front half and the back half, you'll see there's a pattern of an alternating pattern of tight, weak, tight, weak, tight, weak. And it kind of crosses with the others on the back side, which is then the front was tight and then the back is weak. And then vice versa. And it kind of just goes from the top of the body all the way down.
Yeah, I gotcha. So it's kind of cool. It's an alternating pattern, right? Like you're saying. So if you draw a diagonal line, let's say from the pec to the lower back, right? And then again to the hip flexors, one level lower. Every time you go a section lower, it crosses diagonally across the body. So you're seeing X patterns in tightness.
Absolutely. So, just for simplistic visualization, it's literally, if you just imagine the person with the poorest posture you can see, with just totally rounded shoulders, head sticking forward, neck sticking up. Essentially, that's what this cross pattern looks like.
Mm-hmm. So that when those tight areas kind of take over, that'll really affect the curvature, right? And then you see those accentuations within the curves.
Yeah.
And we don't want to just emphasize the tight contracted areas, but also the weak inhibited areas. So we started in the thoracic spine because it's got a great big curve that most people can visualize. Your tight area would be the chest, also the concave area. So there's a visualization that can be seen with like a wave, correct?
Yeah. So your spine's pretty much like a wave. It naturally has these curvatures. Everyone kind of is afraid that they have a bit of a hunchback, that they're like, oh my gosh, doctor, am I developing a hunchback? Is my mid back kind of curving forward? And everyone's kind of afraid of that, and everyone thinks that they have a very straight spine. But actually, in reality, your spine has already some bit of curvatures in it. Mm-hmm. And so kind of what Dr. George is saying, in your mid back, if we start there as the anchor point, you have this, it's shaped in what we would call a concave. So it's hunched backwards. So you have this hunch. In the front is where all your organs, like your heart, your lungs are. But then extending out of your mid back, you have your low back, which is then curved the other way. So you have a convexity where your intestines are, and actually where your low back is from the back view is more of a concave. Mm-hmm. And then the same thing is the neck. Extending from the hunchback in your mid back, you have it curves the other way where The front of your neck is then the convexity, and the back of your neck is the concavity.
Yeah. And for everyone that, like, concave, convex, we learned this in, like, grade 5 and probably forgot it many times since then.
Yeah, when you're learning about lenses and, like, light and all that stuff.
Yeah, that's exactly it. And the only thing that really stuck with me for sure is concave is the cave side of a curve. So if we're looking at a wave, whatever dips inwards is going to be the concave side. And when we're thinking about cross-postural syndrome, the concave side is going to be the tight side. It's the convex side on the outside of the curve that really has to pull or be strong to keep that wave straight and upright. If the concave side's always winning, the curve will start to kind of turn.
You'll see it essentially collapsing the other way. So it's fighting it from collapsing.
Right.
And that makes a ton of sense when you just think about it. Like, everybody knows that your upper back rounds forward, but they also understand that your head is supposed to be supported over your pelvis, right? So that's why people have kind of that misconception that your spine might be straight. But really what those forward and backward alternating curves do is they help for shock absorption, they help support the weight of your head, and all of those things. The only issue is that biomechanically, like Matt was saying, all of the muscles on that concave side, they have a mechanical advantage. They have shorter to go. They're going to be stronger. Their attachments are closer to the axis of rotation. Yeah. And so that concave side will always win. And then on top of that, we also have the force of gravity that pulls that concave side down. And so really, it's a really uphill battle for all the muscles on that convex side to try to pull everything up and keep you upright, which is why good posture takes a lot of work. Like, it literally takes muscular work in order to keep that spine where it needs to be.
Yeah, absolutely. And if we wanted to break that down for everybody, when we're thinking the concave, I just want to go through the spine and give everybody a visual, right? Yeah. So everybody has, well, a lot of people have pain in the back of their necks, right? For multiple reasons. But that would be the concave side at the top of the curve, right? You go down a level, people have really tight pecs, right? That's the concave side. You go down another level, you have the low back is very tight, concave side. Down further on, you'll find the hip flexors are very tight. And now if we want to work our way up, the glutes, starting with the glutes, that's on the convex side, they're weak. The abdomen, that's going to be weak. Middle lower trap area, that's weak. And the front anterior neck muscles are the weak ones. But you brought up an interesting point that I want to talk about is the fact that our is a wave to help deal with many forces, but especially compression to fight gravity. So how does that affect, the joints in that curve, right? Because if you look at the wave curve, the cross sections, the middle of the junctions of those curves where a convex becomes a concave or vice versa, are taking the most compressive forces. So as chiropractors, the three of us, what do we typically find in those areas?
Yeah, so I think that's a great point. Like, those are always the areas that have the most pressure on them. They're the most, like, stuck. Everybody has issues in those areas. And when you think about it biomechanically or schematically, if a C curve goes all the way back and then the next one goes all the way forward, that joint between the two edges of the C is going to have to both move a lot, but also have a lot of stability, because that's where the most of the compression is going to be. And so for us, those kind of main junctions are right where your skull meets your neck, right where your neck meets your upper back, right at the bottom of your ribs where your lower back starts, and then again kind of between the bottom of your lower back and the sacrum or the tailbone. Those are all those junction points where the curves change, and that really is where we find most of the issues either coming from or as a result of this bad posture.
Yeah, absolutely. Like most of the patients, and even you listeners, I'm almost certain that if you have any pain, it's going to be one of those areas.
For sure.
Primarily, and probably radiating out of that.
Yeah, and we find those are also the most challenging areas to adjust because they're in those junction areas. They're so locked up. And yeah, of course, like the curve is meant to help with compression loads, but when you have a non-uniform curve because you're suffering from these cross-postural syndromes, it throws off the alignment. There's too much curvature in one area, and then those center pieces, those midline areas, are taking more and more compressive forces, which really locks them up.
That's exactly it. Like if you think of like a suspension bridge, the reason why they're so light and they're so relatively simple is because the tension is distributed throughout the entire bridge evenly, right? Whereas the issue is if there was a lot of tension in one spot, such as if your spine isn't moving properly, if it's not distributing, like you have 12 vertebrae in your thoracic spine or your upper back. If each of those vertebrae isn't contributing equally, then there's going to be a lot more pressure on one of them, and chances are that's going to be that junction joint, either at the top of your back or where the ribs meet the lower back.
Yeah, and that's a good point. When you look at actual mobility, right? If you have that area where your mid back meets your lower back that's really stuck, well, for the joints above and below, that means they're going to have to work overtime to deliver on that joint motion.
Yeah.
Right? So if there's limitations in the middle, above, and below are working harder to provide that motion, and that's more stress on those joints, as well as more joint irritation in the kind of stuck and compressed joints.
Yeah, and it's really a snowball effect too, because if the joint isn't moving, then as Dr. Matt said, both of those joints above and below have to move more. Okay, well if they have to move more, then some of the muscles need to be stronger and other of the muscles need to be like looser or more relaxed. And so that puts more uneven pressure on that area of the spine, and then that causes more muscle problems. And that's why posture is really one of those things that once it gets bad, it can get worse and it can be hard to correct. But what if we stop that snowball effect, then a lot of times things can be corrected.
Right. It's just all about momentum, right? Like you have the momentum towards the bad habits, which ultimately, and we've seen it all, like leads to ultimately degeneration in the spine and arthritis, frankly. But you can start the momentum the other way and start preventing and start maintaining your spine so that it can maintain as literally for lifelong.
Yeah, it's it's somewhat of an uphill battle in today's society, but it's a battle that at some point you have to look at yourself and decide to take, because this is the only machine that really matters at the end of the day is your body, right? Without it, you're kind of lost. But I like a point that Alex brought up is that if these joints are working overtime and they're not having the stability of proper muscular tension or the stability of having uniform movement throughout the spine, these muscles will tighten up. Certain muscles will tighten up to try and provide that stability. So it kind of works both ways in terms of the muscles will affect the joint mechanics and the joint mechanics will affect the muscle tension. And I think that's especially cool when we look at the way muscles in joints are innervated, in which the muscles that overlie the joints have the same nerve contributions as the joints themselves, if that makes sense.
Yeah, it totally makes sense if you think about it. Like, if your brain is trying to control the movement of a joint, and so it gets all that sensory feedback from the joint capsule, all those receptors, it would make sense that the same program would also take control of movement of that joint. And same thing. The whole thing is all working together. Your muscles, your tendons, your ligaments, your joints, all of those different tissues are working together to accomplish the same goal. And the issue is we just want to make sure that load is spread properly, right? Your bones are super strong. They're meant for compressive loads, but they're not meant for movement. And so you need your bones to be doing the job of your bones. You need your muscles to be doing the job of your muscles, right? You don't want your muscle acting like a bone, and you don't want your bones acting like a muscle. It just doesn't make sense. It's not very efficient.
Yeah, well put. And what I've kind of thought was cool too is that if you have nerves that are irritated or being pinched within a joint, which could happen in the joint capsule or with just the grinding that could go on with joint dysfunction. That nerve irritation can cause reflexive tension in the muscles as well.
Yeah, that's the thing. Like, that nerve is sending a signal to your brain about what's going on in that joint. And if it's not moving properly, or your brain thinks that it's injured, it'll keep sending more and more muscles or more and more signals to that muscle. And I tell patients all the time, especially if you have a traumatic injury, your brain thinks that whenever that joint is going to be in that position, you're going to get injured again, because that's what happened last time. And so a lot of what we do is essentially teach the brain and teach the nervous system that this is an okay range of motion. You're not going to get pain from here.
Yeah.
You don't have to have tight muscles. Everything can relax. Everything can move properly. And it just takes a little kind of convincing through exercises, stretches, that kind of thing.
Right. So it's your body's like fight or flight response, that when you have pain in a joint, that, oh, we need to guard that joint. We need muscles surrounding that joint to tighten up and protect that area. When in fact that's done to a fault most of the time. Most of the time we just aren't putting that motion back in the joint to tell our body it's okay to relax. Very good stuff. Okay, so we know that this pattern is very common across populations, and that's because a lot of the variables that are affecting these cross-postural syndromes are common for all people. We honestly live pretty similar lifestyles, but where do we see the variation in these patterns, Dr. Kevin?
Yeah, honestly, we see these patterns everywhere in society. Actually, kind of how our society is constructed, it pretty much promotes these cross-postural syndromes to occur. Really common one would just be like sitting at the desk, or sitting in your car. Actually, frankly, just sitting in general, really promotes some of these patterns. As we're growing up, some of the sports and activities that we take part in, we're not conscious of making our bodies symmetrical. We just really want to just get better and better at our sports, and we leave other parts of our bodies behind while we train up one. For example, I think Dr. Jersey, you're just talking about how you used to play hockey.
Yeah, so this is something that I found, is that I grew up playing hockey and doing martial arts and also playing soccer. And
So a lot of lower limb type activities.
right, no throwing sports, lots of kicking, lots of hockey. Anybody that plays hockey is known to have a hockey butt, and is just known for that glute extension, right? So my hips, I never really had hip issues. I always felt like I was strong in that area, but I always sucked at throwing a football or a baseball. And as I gotten older, and realized, my hip mobility or my shoulder mobility wasn't great, and that's something that I've worked on and improved upon. But to me, it was just interesting how, oftentimes the sports you grow up with can determine how these cross-postural syndromes affect you, and I guess where the neglect was in certain sports fields, how that variation is going to hit you, right? And maybe if you were throwing a baseball growing up, you do have really good upper cross syndrome, back strength, hip, shoulder mobility, and things can go, have variability in that sense.
Yeah, I definitely agree. And part of the issue we see, especially in youth athletes, especially in more competitive sports at younger age groups, like a lot of the female sports, gymnastics, swimming, dance, like all of those kind of more flexibility, more mobility sports, we see a big issue. Like, I see a lot of patients that did that for 10, 15 years when they were younger, and now they're in their 20s and 30s and they have all these issues. How come? Well, for them, they were already naturally flexible, probably. They practiced becoming more flexible, and so they kind of had this snowball effect where they could move this more and more, but they actually didn't have any control over them. And so that's kind of a disaster scenario. Like, if you have a former gymnast who's super, super limber, super flexible, has really good mobility, but now she works at a desk for 8 hours all day. She doesn't have good core control. She doesn't have good hip and lower body control. She can't stabilize that spine properly. And so you just get a greatly accelerated rate of degeneration, of wear and tear, all those kind of things, just because we didn't address those imbalances, and in fact we made them worse their entire competitive career.
Yeah, that's such a interesting point to bring up. Like on the spectrum of cross postural syndrome, they're sitting more on the muscle inhibition or weakness, lack of stability side as opposed to tightness. And I think people are so quick to go, oh, I have chronic stiffness, or I have stiffness in my low back. I need to stretch it. But no one ever thinks, I have stiffness in my low back. I need to strengthen my glutes and my abs to correct this.
We just want some loosening, or we want someone to get their hands in there and just loosen it up. But we don't want to. Sometimes we don't want to do the work ourselves and strengthen the areas that are weak.
Right, because you strengthen an area, you feel sore. You don't think that in the long term that is actually going to prevent future soreness if done correctly, if you're targeting the right muscle groups
Right.
To the right extent.
In the other areas where the actual problem is. And you guys mentioned a lot of the sports, but even if you weren't involved in sports, growing up and as a teenager, I remember the cool thing was to slouch and just pretend you weren't you didn't care about anything. And
that's a good point.
Or sometimes for myself, I grew up kind of shy, and so you kind of duck yourself, hide up and kind of curl up like a turtle. All those things, it doesn't seem like you're activating any muscles, but all those things are promoting that cross postural syndrome.
Yeah.
Where you're tightening those things passively because you just habitually do that, or you don't train, to stand up tall or to sit up straight like a teacher's pet.
That's a good point, because kids love to have terrible slouching posture.
Yeah, on purpose. They love it.
Act like they don't care, or act like they're whatever. And it's funny because posture is just as much like a mentality.
Absolutely.
Right? Like if you're feeling anxious or sad or reclusive, you're going to adopt a reclusive looking posture.
It's funny now because you look at studies in terms of and now that we're adults and we're okay, who are the attractive ones out there? I think there's studies that show the ones that stand up tall, that aren't kind of curled up or hunched, one, convey a lot of confidence, but actually two, just overall physique looks more attractive.
Yeah. Good posture is attractive.
Exactly.
More or less. You have nothing to hide, and you're standing tall for everybody to see. And it emits a lot of evolutionary information that people kind of lose sight of nowadays.
Yeah, it's definitely true. Biology in general just has an eye for symmetry and an eye for similarities on each side and everything like that. And so naturally, you're going to be attracted to somebody who's symmetrical side to side and front to back. Whether you even understand that, subconsciously your brain knows that. You're well, that guy's standing up pretty tall and he's looking pretty good kind of thing. You don't necessarily think that, but your brain thinks that for sure.
Yeah, without having a conversation with someone, you can look at two people and typically tell which one is more confident.
Exactly. Yeah, 100%.
Which is crazy.
So there you go. It's not, cross postural syndrome is not just about pain. It has a lot of other benefits, once we put in the work to actually tackle these patterns that we have.
Mm-hmm. So how do we put in the work? I know, but do you guys know?
So the biggest key, we're kind of harping on stretching a little bit, and we think it's kind of a misconception that that's what people naturally gravitate towards. But a lot of times you do need to stretch some of those tight tissues, at least at the start. Mm-hmm. Otherwise, those super weak muscles, they can't do anything. And so a lot of times going to a healthcare professional and having them work on the specific muscles, that's another thing too. If you think about trying to stretch your hamstring, that thing's 2 or 3 feet long, right? Are you really going to stretch the part that needs to get stretched? Probably not, right? It's the tight part. And a practitioner, physio, chiro, whatever it is, they can kind of hone in on the specific tissue that's the issue. And so once you figure that out, then you can start to figure out what the counteracting tissue is and start to rehab and exercise and all that good stuff.
Right, because it does get more specific. If you have lower cross syndrome, have pain in your low back and all this stuff, well, you can try and take the shotgun approach to, okay, well, I need to stretch these muscles and these muscles, strengthen this and this, and that will be true to most extents. But there could be, a component of, well, you actually strained your left hip flexor years ago and it's just had chronic tightness ever since. And it is the biggest contributor to this issue, right? So it's good to get that specificity that a healthcare provider can bring to the table. Not to say that they're going to take you all the way through this journey, because a lot of it is going to be obviously posture and how we work at our desk, how we maintain exercise and have the right exercise program that's going to correct the issue and avoid activities that are going to be making it worse. So it's a really comprehensive journey, but you kind of do want a professional in your corner.
Yeah, I mean, I have to totally agree with these guys. Like, as common as we see these syndromes, unfortunately, they're all very individualistic. I mean, as we kind of mentioned, like the way that you grew up, whether you played sports, maybe you didn't play sports, and the kind of jobs and activities that you partake in now, like which ones are promoting these syndromes, which ones are helping against it, which ones do you need to stop, which ones do we need to promote. Unfortunately, there's no like overarching answer for that. It's kind of just a really case by case basis, and really depends on, what is your history, what's your background, and what's your current state now, and where do we want to take that.
Yeah, and I find that the patients that we get to work most closely on correcting these issues are the ones that are going above and beyond, right? Like, someone can come in and have shoulder issues or shoulder impingement, and we can fix that problem. And as soon as they're out of pain, they want that work to be over. Well, we'll find that these issues will be reoccurring until you correct the overall postural issue, which is a lot harder to correct than just getting you out of pain. So it's really for the people that recognize that, their body's a machine and it works best when it's perfectly symmetrically in balance.
Yeah, like, I mean, if I was to play on that example, really key there is, shoulder impingement oftentimes is, the rotator cuff muscles are in the poor position. But why is because your shoulder blade is not in the right position mechanically. And why is that happening? Because your pec muscles pulling it forward into that cross postural position.
Yeah.
And so, ultimately we can get the rotator cuff muscles strong and, not pinching anymore, but it's going to happen again if you don't fix the position of your actual shoulder blade.
Yeah, and the same can be found in the lower cross. It's funny because impingement is really for me, the syndrome of cross postural problems, right? Mm-hmm. Like it's one of those issues that really arise when this cross postural syndrome has taken hold, and yeah, you'll get pinching either way. And you're right, you got to work on the pec to just put your shoulder blades in an area where they're at lesser risk of having these issues. So basically you're putting your body in a position you're reducing the risk of future injury, you're optimizing your athletic performance because your body's working in perfect symmetry, right?
More efficiency.
Yeah. So you're not only getting out of pain, but you're increasing your performance, really.
Yeah. And I think that's a great point, because people don't realize that pain is always the last thing to come on. People might have had these underlying compensation patterns or really old injuries or any of those things. And especially if ever you thought like, oh, I used to have this thing, but it got better on its own. It's like, did it really? Like, it got better on its own, or you just got used to it, or you just don't notice it? And so what we tell patients all the time is that our main job at the beginning is to give you a window of opportunity where you're not in pain, right? If it hurts to move your shoulder, of course you're not going to do rotator cuff exercises and all these things. So we get you out of pain. We get you able to do the exercises where you can strengthen, where you can stretch. And then really all we're really trying to do is give you the tools to be successful going forward in your life. Like, you're only in the clinic 20 minutes a day or whatever, and you're off working, you're off sleeping, you're off doing everything else yourself. We can't be there to help you with your posture. We can't be there to help you with with these issues. So we give you the tools to not have them in the future, rather than just addressing the pain.
Yeah, and that can be a hard thing to communicate, and a hard thing for patients to hear is when they're out of pain, that we actually want you to continue coming in so we can fix this from coming back. And as tough as that is to communicate, a lot of times these people will be good for a year or so, and then the issue comes back because the dysfunction was still there. But again, the patient really has to work with you on, I want to make, because it's a lifestyle thing, right? It's pretty different. If you come in and we just treat you and get you feeling better, that's one thing, but you really have to adopt the lifestyle to get the lifelong fix. So that can't be forced either.
Yeah, that's a great word, like lifestyle, right? It's not a one-time fix, not necessarily an injury. It is just converting into a more active lifestyle where you're conscious of what you're doing.
Yeah, and not everybody is willing or wanting to go down that route, and we're still here to help them. If whenever they fall into injury, we'll get them back out. But of course, we'll always, suggest this is the path of least resistance, as Dr. Uchez would say.
Yeah. And Dr. Kevin was talking about before about like the momentum and how it's hard to break that pattern, but then it gets easier. And that whole piece of exercise, sleeping position, posture, like all of these things come together, they do get easier, right? Once you start to get in a shape where you can exercise regularly, well, then you also start eating better and you start sitting better and you're not as sore, so you're not compensating, so your muscles feel better. Like all of these things, it's just this big cascade of momentum, but the issue is just getting it started. That's the really hard part, but once we get that first inertia moving, it's actually pretty easy, especially if you make it routine, to upkeep those patterns in your life.
Yeah, knowing is truly half the battle in this, and your body is pretty good at telling you when you're not being perfect. You just got to listen to it, and it'll tell you, hey, don't sit like that, don't study on your bed for 3 hours because this is gonna hurt, right? Anyways, great stuff here. Glad we covered this topic. That's all we got for today though, but definitely come check us out at Proactive Health Group here in downtown Calgary. Thanks to Dr. Kevin and Dr. Alex for giving us this great info.
Yeah, thanks guys.
Thanks.